Hi everyone, Dr. Luke Peterson here with the Knee Replacement Therapist. In this video of the Need to Know Show, we're going to look at different exercises and activities that you can do to specifically improve your walking and gait after knee replacement surgery. Hey everyone, so for walking after knee replacement surgery, it really tends to be a common issue, a common concern in terms of how to walk in a way that is comfortable, a way that is energy efficient, and that is just overall tolerable and doesn't lead to any impairments or aches or pains in other parts of the body. And we talked about initially a couple of days ago how the first line of defense, I guess, so to speak, is to address the underlying impairments. So address the things like your knee range of motion, managing your pain, managing your strength or strengthening and building muscles and stability in your hips and your quadriceps and your thigh muscles. We talked about the need for good balance and stability and coordination with walking, and just how improving those overall is going to in turn lead to better walking and gait patterns. And then another thing as well is just general physical activity and exercise. Even if it's not specifically walking, general physical activity and exercise is going to lead to improvements in your walking. Why? Because the same idea, you're starting to improve your strength, you're starting to improve your motor control, your balance, your stability, you're improving your range of motion, all these things, your coordination, all these things are going to lead to better walking in turn. So just addressing the impairments, just general physical activity and exercise, and then just walking, getting out and doing the task. I always tell people if you want to be really good at shooting three-point baskets in basketball, the best way to do that is go shoot a lot of three-point baskets. If you want to get really good at walking, go and do a lot of walking and practice walking with good form and good technique. Even if it's not perfect, try your best to mimic good technique and good form as you do it, and it'll get better and better. Now the last thing, or the other thing we can do is some specific exercises that tend to exaggerate or overemphasize different parts of walking. And so that's what we'll show you here today. So one of the first ones I want to show you today is weight shifts. So big thing with walking is shifting your weight. You're going from one foot to the other, accepting that weight, being comfortable having that weight and your body weight on that leg, both your surgical leg and the non-surgical leg. So one of my favorite activities is just doing weight shifts, and I call them anterior to posterior, forward and backward weight shifts. So I like to get in this staggered stance, one foot in front of the other, keeping the hips about hip width apart. You don't want them together like this, like a tightrope just yet. And you're just going to practice weight shifting. If you don't feel totally comfortable initially, have a chair, have a table, something to hold on to for stability. And you're just going to go forward and backward. Forward, put weight on that front leg, backward onto the back leg. Feel free to lift the heel and lift the foot a little bit on that back leg as you do this. And just get comfortable accepting that weight back and forth. Do a bunch on this way and then switch feet, do a bunch the other way as well. Then you can start to progress to doing lateral weight shifts. Of course, this is a different direction of motion than your typical walking, but also just another way to start to practice and get comfortable with putting that weight into your leg and through your leg. So there's forward and backward, and then lateral weight shifting. Another thing I like to do is called leg swings, and this is something I actually saw another physical therapist, Anthony Maritato. He's a great physical therapist, does a lot of knee replacement, knee specific activities and videos, so feel free to check him out. He does leg swings, and I've started to incorporate that as well. And it's not your typical straight leg swing, but instead trying to mimic or exaggerate a little more the leg swing needed for walking. So as you walk typically and you lift that back foot up, you start to bend, you have to bend that knee in order to clear it and bring it forward. Otherwise you start to get a lot of compensations. So what I like to do is you stand, again you can hold on to something initially, and it's almost like you're standing and you're just a pendulum almost of your knee and leg. And you can really exaggerate it. And you're almost like you're kicking a little ball that's in front of you. And exaggerate bending that knee back behind you and extending the hip out. Exaggerate bringing it forward and straightening and extending the knee. And just do a bunch of them. Do 15, do 20. And then switch sides and do the non-surgical leg. Again, this is just getting comfortable with that knee range of motion. You know, you might be able to get good knee range of motion laying on a table, but then when you go to stand up, you don't feel comfortable, feel a little uneasy. So get comfortable bending the knee, going through that full range of motion in a standing position. The next thing has to do with balance and stability. So just general single leg balance. Start with something to hold on to, move to not holding on to is ideal. See if you can hold it 15, 20, 30 seconds is awesome. Switch legs, do the other one, single leg balance. Then after that, I like to incorporate movements with it, a little more advanced. So now you're standing on the one leg and you're mimicking the swing phase on the other leg. So for example, you're standing on this leg and then you're swinging the other leg. This takes a lot of stability, a lot of coordination. I'll have athletes that I work with who will fall right over and can't even do this exercise that seems very simple. You can start to incorporate arm swings with it as well. You want to remember that it's going to be the opposite arm and leg when you're walking or running or anything like that. And again, this is building that stability, building that coordination that's common with walking. The next thing I like to do is just getting comfortable with the foot and ankles, being upright and standing. So you can do heel raises or alternating heel raises, toe raises. Again, holding on if you need to. You could do single leg heel raises, a little more advanced. And something I like to incorporate too is just walking on your toes, maybe doing 10, 15 feet. And then also bringing your toes up and walking on your heels, just to strengthen those muscles of the ankles, the calf, and build stability and strength there as well, and coordination. Some other things, moving on. So for example, a common thing is your stride length or your step length. So a lot of people have decreased step lengths after surgery. And so one thing I like to do is do something that starts to exaggerate that step length. So putting a little obstacle, you might not have seen it, you probably can't see it on the video here. So I put down some cones, and you can put down, I've seen people use yardsticks, you can use pieces of 2x4, whatever you may have, golf clubs, and you're just spacing them out enough that you're going to have to exaggerate stepping that bigger distance as you walk. Taking those bigger steps, focusing on the heel strike as you come down, so straightening, extending that knee, initial contact with your heel, and then alternating. So again, that's, you can do that. I like to use the visual cue or the external cue of a cone or a yardstick or something like that, but you can even do that with, if you don't have anything to use, and just focus. I'm going to take very big, exaggerated strides, and that's going to focus on that step length or stride length after surgery. Another thing I like to do is called walking the tightrope. So I have the stretching strap. Again, you can use a yardstick, you can use a 2x4, you can use a piece of tape on the ground, and some things you can do are, again, just doing kind of this heel to toe walking. This is going to build that balance, that stability. Practice walking with a narrow base of support. I also do like this crossover walking, so walking one foot on one side and then crossing over to the other. And one of the reasons for this is after surgery, you know, there's a lack of balance, a lack of stability, and so we start to maybe walk with this wide base of support. We walk maybe our toe out. We're using our hip abductors, swinging our legs around. This kind of tightens everything up, bring your leg together. So now you're coming more of that straight path walking, not compensating with your hips, hip adductors or anything like that. So again, you can do the tightrope. You can do the crossover walking. If you get really good, you can do walking on your toes on the tightrope or walking on your heels on the tightrope. You can start to get creative as you get better, add a little bit of a challenge to it as well. So that's just a handful of different exercises that I like to incorporate. Again, they're kind of exaggerating those typical demands that you might see when you're walking normally. Obviously, you aren't going to be walking on a tightrope, you aren't going to be walking on your heels all the time. You're not going to be walking with these huge, big strides, but by exaggerating them in the clinic or with your exercises, then when you go to do normal walking, walking with that normal pattern, that good base of support, that good stride length, that good stability will be that much easier to do. So that is exercises, activities to help improve your gait, improve your walking after knee replacement surgery. Thank you very much for watching, everyone. As always, please subscribe if you enjoy these videos. I post daily. If you have any comments or questions, I'd love to hear from you as well. Take care.